Deirdre Nero owns an immigration law practice in Miami, Florida. She stands in front of courtrooms using every skill at her disposal to successfully represent her clients. Nero meticulously plans it all, from her opening statement to the color of her blouse. No sign of the autoimmune disease hiding just under her wig.
I have what's called the universalis, which is basically no hair anywhere on your head, your body, no eyebrows, no eyelashes, no nose hair even, like just no hair at all.
Universalis is the most severe form of alopecia, a condition that causes a person's immune cells to attack hair follicles. Some people might have small missing patches in their scalp or facial hair, but others like Nero don't produce any hair at all. Alopecia might seem mostly cosmetic, but think about not having any nose hair to filter dust and pollen, or eyelashes to protect your eyes.
I constantly am with a runny nose or sneezing or some kind of allergic rhinitis type of condition all the time. I have constantly feel like I have sand or rocks or stuff in my eyes all the time. I go through like a bottle of eye drops a week, maybe 2.
And due to the lack of body hair, Nero's always colder than the average person. But she says these issues aren't the hardest part of living with alopecia.
Those are just little things beyond the big thing, which is really, losing your kind of identity and having to look at yourself and see yourself just totally differently. And then know that out there in the world, everyone else is going to also look at you differently and identify you as being different and as someone that is not, I hate to say it, but not normal, right? Like a bald woman walking down the street gets a lot of stares and gets a lot of questions about, do you have cancer? That's one that I get all the time. People asking me about my chemotherapy treatment. And then, that uncomfortable feeling that I have to then, what do I say to that person?
But her condition wasn't always so extreme. Nero first noticed something was wrong while studying abroad in Spain when she was 21.
Always I had been known as like someone with super thick hair who could like barely fit it into a clip or anything. So for me, it was like crazy to then think, oh my gosh, I'm going bald. But I actually didn't know what it was at all. I flipped my head over to the side while I was blow drying my hair one day. I was living in Spain and I just saw like a perfectly round bald spot that was about the size of a 50-cent piece, more or less, perfectly smooth. Like if you run your hand over like a piece of marble or glass, smooth like that.
At the time, Nero had no idea what had caused the bald patch.
I called my mom. She was in America. I was in Spain. And I was trying to describe to her what happened. And I remember I was crying so hard that she couldn't understand me. And she just kept saying like, what? Like, I don't know. I can't understand you. You're crying too hard. Like, calm down. I'm sure it's nothing. I'm sure it's fine. Then finally, once she understood what I was saying, she obviously just tried to calm my nerves and told me not to worry about it and just to have a good time on my, semester abroad, and that we would take care of it when we got home.
And when Nero finally returned to the U.S., she went to a dermatologist who diagnosed her with a condition she'd never heard of, alopecia areata.
So I just kind of stared at the doctor like, okay, what does that mean? What is it? And he basically just said to me, yeah, it makes your hair fall out. There's no cure for that. There's nothing I can do for you. Goodbye. Like that was like the extent of the whole first doctor's visit. So that was like then a whole other kind of traumatic experience because he didn't really give me any information, no compassion at all.
So Nero used the power of dial-up internet to do the research herself. Unfortunately, all of the information led back to 2 main points. There's no cure for alopecia, and there are no truly successful treatment options. And for the last 20 years, those ideas still held true until now. The FDA recently approved the first systemic treatment for alopecia areata called Olumiant. Dr. Brett King acted as the principal investigator for the drug's 2 clinical trials. He says this is a historic opportunity for people like Nero who suffer from severe alopecia areata.
Having an FDA-approved medicine means that I have the opportunity, somebody comes to see me, I have the opportunity to make them better. So many of these people, and we're talking here about hundreds of thousands at a minimum of people in the US, have been told there's nothing to do. Get a wig, get a head covering, get counseling. And so it's a gigantic step forward to be able to have a treatment that is going to restore normalcy to maybe even half of them.
Olumiant is for people with severe alopecia areata, meaning those with more than 50% scalp hair loss. In the clinical trials, King says nearly half of the participants had complete hair loss on their scalps. Generically known as baricitinib, the oral medication is different from other broad immune suppressants that wipe out every immune cell in a patient's body.
Baricitinib doesn't work to knock down all immune cells. It actually works to interrupt messaging by a set of chemical messengers in the body. So when those chemical messengers are responsible for causing disease, you interrupt disease. You make disease better, but without broad suppression of the immune system.
Up until this point, doctors didn't have much success in treating patients with alopecia areata. One method Nero tried for a while involved receiving cortisone shots directly into her bald spots, both on her scalp and eyebrows.
It's like playing whack-a-mole. Like you're injecting one spot and it might cause the hair to grow back in that spot that's being injected, but it doesn't prevent you from waking up the next day with a new spot in a different location.
And after a year and a half of eyebrow injections, the treatment suddenly stopped working.
Even though I was getting the injections on a regular basis, the hair just started falling out again. And my dermatologist just looked at me and I could tell on her face and she said, "We can't do this anymore. It's just not working." And I was really upset by that news. But, I understood her position that she didn't want to keep injecting steroids into my face, basically, if it wasn't going to do anything.
Nero eventually had to stop the scalp injections, too. The patches had grown larger, and soon her head had more bald spaces than hair. And just like that, her only source of treatment was taken away, forced to sit by and do nothing while losing the rest of her hair.
It's like losing a body part, because it is. It might not be an arm or a leg, but your hair is part of your body. And so when suddenly part of that, something that defines you as a person is just gone, is losing a body part. And it can be very traumatic and it can affect people emotionally really severely. Looking in the mirror and not recognizing yourself is very painful and a very strange feeling.
It took several years for Nero to finally buy her first wig. She knew it was time when she could no longer style her thinning hair to cover all the bald spots. Now she calls herself a half-timer, usually only wearing the wig in a more professional setting.
It's almost like part of my outfit. And when I'm trying to present more professional or more dressed up, I feel like I want to have a wig on. And when I'm more just casual hanging out, I'll be bald. So that's where I've gotten to after years and years and years of this. But in the beginning, not at all. Like I didn't want anyone to know I was wearing a wig. I was really embarrassed. I was petrified that people would notice and say something to me. And I remember one of the first days I wore my new wig to work, one of my colleagues came into my office and was like, "Are you wearing a wig?" And just asked me flat out like that. And I was mortified and really taken aback, and I denied it.
Nero says it took a while for her to be comfortable in a wig. One thing that really helped was volunteering for the National Alopecia Areata Foundation, or NAF. As an advocate, she noticed that her fundraising strategy was more effective when she wasn't wearing a wig. Then, little by little, Nero gained back her confidence.
Now, if someone compliments my hair, I tell them, "Oh, it's a wig. You can buy it on this website for, this amount of money. And this is the color code that I bought." I'm very open with it now, but I wasn't always that way. But we're very accepting with each other. Some people definitely never wear wigs and other people do. And some people are kind of in between. And none of that is right or wrong. It's all about how you cope with having this condition.
Nero gives credit to NAF for being a big part of her own journey towards acceptance.
For a while there, I just felt completely alone, like I was the only person on earth that had this disease. I'd never heard of it before. I didn't know anyone who had it. I had never seen pictures of anyone with it before, so I really just felt completely alone, like I was the only person on the planet. And then luckily for me, once I did find the foundation, I learned that that's not true. There are other people just like me and who are going through the same thing. And so that support system really saved me, I think.
Nero now serves on NAF's board of directors and continues to volunteer as a legislative liaison. She calls her work a labor of love.
All the time that I spend doing work for them is giving back to them for basically saving me because I was lost and really alone. So it really allowed me to turn something very negative into my life into a more positive and empowering experience. And so for that, I'm always grateful to them.
NAF provided comfort for Nero even at a time when they couldn't offer any solutions.
I remember one of my first Alopecia Areata Foundation conferences that I went to, there was like a panel of doctors and they just were like, yeah, there's nothing like that. I mean, they didn't say it in that way, but I mean, there was just almost nothing to talk about in terms of viable treatment options. I mean, there was just nothing happening.
But now, 10 years later, alopecia patients are finally getting their answers, and soon Olumiant won't be the only option. King says 2 other treatments are nearing FDA approval in the next several months or couple of years.
8 years ago, when all of this started, there wasn't public awareness of alopecia areata, but there wasn't pharmaceutical industry awareness of the disease. And so now what's so amazing is 8 years later, we have 1 medicine FDA approved. There are 2 that are advancing toward the goal. And there are clinical trials of completely different medicines than JAK inhibitors that are now in clinical trials for alopecia areata. So alopecia areata is on the map now, and it's recognized as a disease that merits treatment. And my sincere hope and belief is that in the next 5 or 10 years, we're going to be able to make almost everybody who suffers from this disease better.
You can find more information about Dr. Brett King, Deirdre Nero, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Most people don't realize that's not that big of a step away from sci-fi. It's a little closer to reality, but we use the same sort of sci-fi mentality.
How e-tattoos can diagnose an illness.
Then why cancer patients are more at risk for fatal heart disease.
A lot of times when the battle has been won with their cancer treatment and they've been in prolonged remission, we're actually finding that they die of accelerated cardiovascular disease.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
All of these places, they end up on lists that the media makes, like clickbait kind of lists of the most miserable places to live in America.
The towns and cities across America that have been left in the dust. Then,
I do think there has been real movement that we just didn't see before the summer of 2020.
What real progress, if any, has been made since George Floyd's death? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.